Our first chapter of Sports Medicine 1 is going to introduce you to several different professions that are associated in the sports medicine field. I have included a couple videos that talk about athletic training. Briefly talked about sports medicine and athletic training and how the two are related. But in this first chapter, we're going to expand our discussion on other fields and other professions associated with sports medicine. So first of all, we have to kind of have a clear definition of what sports medicine is. Sports medicine is a specialized area of the medical field that is designed to help the athletic population. And what's big about that is that could be athletes the high school age, college age, that could be grown adults who are participating in athletic events. It doesn't matter. It's not necessarily one age group. All right, so a couple of the professions that we're going to discuss: athletic trainers, of course, physical therapists, nurses, doctors, dentists, and physician's assistant. All right, there are several other professions that are associated with sports medicine and with athletic training, but these are just going to be the main ones that we focus on in this chapter. So we have the sports medicine team, and the sports medicine team is a group of medical professionals that are all working together to help make sure that that athlete that needs their care is getting the best treatment possible. Okay, and in the sports medicine team, we see it split into two different categories: the central and the peripheral. Okay, and we're going to talk next about the difference between the two of them. So our central sports medicine team, that's going to be the group that is seeing that athlete on a regular basis. Okay, the very center of the sports medicine team is the athlete. Without an injured athlete, you don't need a sports medicine team. Okay, with that, in the central group, you also have the athlete's parent if they are underage. Okay, when you're dealing with a college age individual, that parent might be consulted, but they are not necessarily a central member because that athlete is old enough to make their own decisions. Team physicians, these doctors work with our athletic teams more specifically. It's different than you just going to your regular doctor that you've gone to ever since you were a little kid. The athletic trainers, if you're at a school that have access to them, because we are the ones that are at every practice or at your games, we're going to be usually the first line of care for any athletic injuries. And then we also include the coaches in the sports medicine team, because a lot of times those coaches know the athletes better than the athletic trainers, and they're certainly going to know them better than the team physician or any other member of our sports medicine team. The next branch, the next category, is the peripheral, okay? And these people are not going to be coming into direct contact with that athlete on a regular basis. The first one that we see is your primary care physician, and these are going to be the doctors that you go to for everything. When you're sick, that's who you go to. They have a good working history with that patient. They know them, but they may not be as trained in the musculoskeletal injuries that we need. So we'll put our student athletic trainers in this group, and that is not for the fact that they don't see the patients or the injured athletes every day. It is more for the fact that they do not have the training to be in the central group. So that's kind of one of those that we kind of get confused on which group that they go into, because a lot of times they definitely know the athletes better than we do. We also see a common trend: anything that is a specialty, and we know that it's a specialty because it has IST at the end. So we see physical therapists. They specialize in rehabilitation of injured athletes. We also see podiatrists, allergist, urologist, cardiologist. All those guys are specialists. We would lump them into the peripheral group because they are not seeing those patients on a daily basis. Now we're going to talk a little bit more about each one of these professions. It's just going to be very brief. because we are going to be mainly focusing on athletic training because this is a sports medicine program at a high school, but we're going to do a little bit more research with one of our projects on these professions. The first one that we see is nurses. So the big thing about nurses, they have to go through different trainings, just like a doctor, just like an athletic trainer. They have different competencies that they have to make sure that they can do. They also work in many different settings. They are in different specialty areas, like they can be an ER nurse that works with those emergency medicine, neonatal nurses that work with the little babies. You kind of get, while in school, you get to try a whole lot of different fields, and then they kind of tend to stick with one particular area. You do have to have your degree and have a state registration in order to teach this. The question is physical therapists. They help the most with rehab. They work a lot of times in partnership with different physicians, and they will do a lot of post-surgery rehabs for our athletes. They have a little bit better setup as far as with rehab versus an athletic trainer because they are only responsible for that. They have lots and lots of equipment. They can give that patient individualized rehab programs instead of where we're trying to do rehab in an athletic training room and there's athletes coming in from all over the place and you're supposed to be on the field for practice. And so we as athletic trainers try to work with our physical therapist to make sure that we are doing everything that we can to get those athletes better. Most of the time these guys will work in a clinic. All right, some of them work in a hospital. It just depends on their setting. They do need to have a 4-year degree as well as a licensure. And a lot of times they will go get a master's degree as well. So there is a video about physical therapists that I'll let you guys watch on your own time. It just talks a little bit more about the profession. The next one is a physician's assistant, okay? And this is exactly what it sounds like. They are going to assist a physician, but it's way more than that, okay? A physician's assistant actually works underneath the doctor, but they have way more abilities than like a nurse, for example. They are able to see patients. A lot of times they are able to assist on different surgical procedures and help with running a clinic, seeing patients in an emergency setting. They do have different specialties, just like a doctor. Orthopedics are going to be one that helps our athletes mostly in the sports medicine field. They do have to have a degree, and you do have to have your master's, preferred to have your master's degree as well. There's also another video for physician's assistants. I'm going to let you watch that video on your own time as well. Our next one is the dentist. We don't really think about dentists in sports medicine as often as we should, but we have had incidences where we've had an injury to the mouth and we've had to send a kid, and it helps when you have that relationship with a dentist, especially if they might not already have a dentist. And so they are part of the sports medicine team because they are providing that service. Okay. You do a dentist path is similar to the doctor path, and you do have to have a residency and an internship. You do have to get your degree, your master's degree, pass your exams. But I would say that a team dentist is a little bit less common in the high school setting and more common in the collegiate setting. And then obviously we have many different doctors in our team, in our sports medicine group. A lot of times we have a doctor that specializes in orthopedist. We have a doctor that mainly sees our concussions. They kind of have their own different areas of specialty, and we work with several different ones in our program. To become a doctor, you have to go through lots of schooling. You do have to go through a pre-med program, and then there's additional I think it's 3 years to go to get your medical degree, and then even after that you still have your residency and fellowship, and so it's about a 7 to 8 year process to become a doctor. All right, these are just a few of the professions. We're going to talk a little bit more now about athletic training. All right. So athletic training, there's two big dates that we need you guys to remember. The first one is AMA, which is the American Medical Association. In 1991, it recognized athletic training as an allied healthcare education profession. And this is basically lumping athletic training into the medical field, saying that the services that an athletic trainer are providing is in line with the medical profession. And the second date is NATA, and the NATA stands for the National Athletic Trainers Association, and in 1950 it was established. Okay, so you can see that this there's quite a big difference here, and that field of athletic training has been building and growing, and it took 40 years before the American Medical Association recognized them as a medical field profession. Different roles for athletic trainers. One of the big things that we do is injury prevention. Okay, and some of the ways that we do this is helping with PPE, which is a pre-participation examination. That's the physical that every athlete needs to have before they're able to participate. They also help with strength and conditioning programs and some equipment. It just depends on your setting. A big part of our profession is recognizing, evaluation, and immediate care of injuries. As an athletic trainer, we're first aid and CPR certified. We help with wound care. We can do everything from CPR to basic first aid. Another component is the rehabilitation and reconditioning of athletes. When an athlete is injured, making sure that they are healthy and able to progress back into their full regular participation level. And there's also a lot of different healthcare administration aspects of it, paperwork and making sure that your facilities are in good shape, and because we are a healthcare profession, so we want to make sure that we are providing our athletes the best that we can with the clean facilities and making sure that we're staying up with our education aspect of it. So speaking of education aspect of it, there are 4 different credentials for an athletic trainer to have, and we're going to mainly focus on 2 because they're the most common. So the 2 that we're going to talk about is licensure and certification. Okay, licensure is a state license. Certification is a national certification. Many states require that their athletic trainers are nationally certified. They don't really have the state licensure. Texas is one that does have the state licensure, and you can be licensed and practice in Texas, but you don't have to be nationally certified. It's just recommended. Something that's changing is in the athletic training education programs is turning into a master program. And so what that means is that you're going to need 6 years before you can sit for these national exams. So that's kind of a new thing that has just happened here recently. An athletic trainer can work in many different settings, obviously high school, colleges, different businesses hire athletic trainers. And something that's kind of been new is a physician extender, and they work in a doctor's office and help to see patients for more athletic related injuries, and not and they still work underneath a physician. There are different domains associated with athletic training. These are different areas that you have to go to school for. They are very similar with other professions in the sports medicine field. Obviously, we deal with injury prevention. Pathology is figuring out what's wrong with the patient. Pharmacology, dealing with the meds, and therapeutic exercises and modalities. How are we going to treat these individuals? How are we going to make them better? And how to become an athletic trainer. You have to go to an accredited program. That's the biggest thing with any profession. And the Commission of Accreditation of Allied Health Education Program is the group that's responsible for accrediting different college programs. And with that, you have to have your several hands-on hours, take your specialty courses, and pass that NATA BOC exam. All right. Like I mentioned earlier, there are 4 different credentials for athletic trainers, and the main ones that we deal with are licensing and certification. However, the other 2 are registration and exemption, and those you only see in a few states. They're not very common. All right. Other courses where athletic trainers have to be proficient in Injury evaluation, knowing your anatomy to figure out what it is that you're poking and prodding on. Biomechanics, talking about how the body